Good day to you, welcome, and I've got two little stories from Canada, because as we know, Canada is very, very dystopian, very along the way of the New World Order, and Trudeau is the WEF agent in power and bringing in these measures. So the first one here is talking about protests, and obviously we have the same thing with wishy-washy, which I told you about the other day. Well, this is Canada, and basically you can sum it up into, if it's a government approved protest, that's fine. If it's not, then it becomes illegal. Have a listen.
You were concerned about setting a precedent where a blockade could equal a change in public policy. Is that fair?
Yeah, I think we have a robust functioning democracy, and public protests are an important part of making sure we're getting messages out there, and Canadians are getting messages out there and highlighting how they feel about various issues. But using protests to demand changes to public policy is something that I think is worrisome.
And then, of course, carrying on from that, if you're talking about the government again, this is Bill 36 in Canada, which gives jail time for healthcare workers who are talking basically out of turn against the narrative. And also, these healthcare professionals are likely to lose their ability to practice if they do not keep up with their regimen of basically. So if they don't want it, or they don't keep up with it, they can get their medical licenses revoked, and obviously this will be quite serious. Whether they want it or not, whether they talk about this or not, it's going to be a legal thing coming in Canada. Have a look.
British Columbia New Democratic Party and its leader, Premier David Eby, are poised to codify in legislation new rules punishing any and all health professionals in the province who are not current with required vaccines, with loss of license, massive fines, and/or incarceration. Dr. William Mackis, a nuclear medicine radiologist and oncologist based in Alberta, told One American News his concerns about the clampdown in British Columbia.
Section 49, for example, makes mandatory vaccinations, that includes COVID vaccines, it makes it a license requirement. So now, in order to have an active license to practice in BC, whether a doctor or a nurse, you will need to have the required COVID vaccinations that the government decides, maybe every 3 months if you need vaccines to keep your license active.
Mackey said another section of Bill 36 authorizes jail sentences for up to 6 months for healthcare professionals making statements that contradict the province's own vaccine information, and also encourages healthcare professionals to snitch on each other.
The misinformation clauses where they encourage other doctors to report other doctors, nurses to report other nurses for COVID misinformation.
Okay, so there you go. That's the story from Canada. Wishy-washy is also doing the same sort of things. Well, it's pretty obvious, really, and every day the dystopian nightmare gets worse, as far as I can tell. However, we have to remain positive and think that this is going to end very soon when people wake up, and people are actually waking up now. That's it from me. I'll catch you later with another video. Bye for now.